let's just have a little examine together. So we've got 70, we've had this for a couple of months. Obviously, she's in quite a significant amount of pain. So I'm going to ask you, I think we're going this way, right? Okay, so the first thing to say is that we've got this slight upper cross posture. So we can see that, but I just want you to observe this. So this is what I would call, and now we've brought attention to it, it will change, but can you see she's holding her arm flexed and internally rotated? So this is what I'm talking about, this default posture, this default, I call it a holding pattern of the nervous system. Now, one of the things I'm going to do is just examine her briefly. I try to keep things very simple with examination. So I either diagnosed anterior, lateral, or posterior, depending where I feel the restriction. So I'm going to start here at the long head of bicep. Now, how's that there? You feel that one?
I can feel it.
Yeah, so that's the long head of bicep. Now, importantly, the bicep often gets involved in the whole range of shoulder problems, and I'll explain that why on the course, but this is really a key area for her. Of course, long head bicep, the short head bicep, coracobrachialis, and pec minor, they all come from this coracoid process. And then as we work around, we can feel here. So here's her supraspinatus tendon. Now, you said to me before you feel it down to the elbow as well.
I do.
Yeah.
And lower.
And lower down.
Lower.
It's really one of the key things that I've kind of stumbled on or discovered is that actually the rotator cuff starts at the elbow, not at the shoulder. And what we can do is, and I'll show you on the course, hopefully when you see me, is that if someone has a supraspinatus tendon, what we can do is we can actually palpate a taut band well below the deltoid.
Sorry, if they have a supraspinatus tendon problem.
Tendinopathy, yeah, because it's part of the rotator cuff.
Yeah.
Generally is the supra. That's usually the main rotator cuff problem. We know that. So when we palpate here, the sort of lateral, that's the supraspinatus insertion. But what we can do is often find a taut band and it goes all the way to the elbow. Infraspinatus is the insertion is here, and she's really definitely got infra here. And we can palpate, again, a taut band all the way down to the elbow. Subscapularis is slightly different. So when we're going to treat her, we're going to actually look at the elbow, and I'll discuss that when I do the treatment, but pick me up on that if I don't. Now we're just going to look at her range of motion. So often I tap the AC joint area just to sort of counter.
Oh, wicked.
Yeah, we're getting there now. So she's got what's called a subacromial pain arc or painful arc. She's definitely got restricted. Now, come down on your own. Now, because she hasn't got, this is what's called a negative drop arm test. In fact, we'll do it here. Oh dear. So she's got a painful arc as we go through sort of, see if you can just gently bring your arm down to your side. So because she can do that, she has not got a full thickness tear. Because she's able to do that. If you have a tear, the arm just collapses, okay? So we know she's got an intact cuff, but she's in considerable amount of pain. I won't do too many tests, but really nice test just to look at. Obviously, we could do some strength and power, so we can look at supra, infra, subscap. We can do that. But just a nice one here, look at your subscapularis. Put both hands on your tummy, and then push your hands to your tummy. And push back as hard as you can on your tummy. And what we're looking for here, this is the belly press test, is weakness in subscapularis. And she's got a little weakness. This arm comes a little bit backwards. Let that relax. Come and sit down for me again. Again, we're going to go through some of these clinical tests together when we see each other. The scarf test, where we have 90-90, and we're going to ask you just to resist me here. So this is looking at the AC joint. Little bit AC, a little bit subacromial impingement as well.
So again, 90-90 meaning 90 degrees
90 flexion, 90 abduction. So
adduction.
Adduction.
Yeah.
And the other one is the Hornblower's test, where we get her to push me this way, testing weakness of infraspinatus, which is weak. I can tell you pretty much, in my opinion, that she has a supra and infraspinatus problem here.